For Nitya Virechana, you said a medicine including Jayapala, Trifala.
Usually, I use a capsule called Purilax from Pentacare, which I use it, which contains Estimadu, Trifala, and even the Aragbada to some extent, and even Swarnapatri is also there in that. Along with that, it is given a Bhamana with Jaipala. So that combination, very good bowel cleanser. I use them. But in some patients where I feel they are a little bit sukumara in nature, then I go for Haritaki Churna, simple Haritaki Churna, mix it with Guda. 1 teaspoon of Haritaki Churna mixed with 2 spoons of Guda and make them to eat in the morning once, and that will give them very clearly 2 to 3 times purge, and which can expel the excess water from the body. And of course, in indirectly removing the water from the gut, it also avoids the accumulation in the peritoneal cavity. And the body slowly reabsorbs the material from the peritoneal cavity, and automatically the peritoneal cavity fluid settles down.
Can Avipatikara Churna be a choice, sir, based on availability?
It can be done, but I don't think so that may yield results. Many a times, see, in one of the patient, recent even day before yesterday also I had a patient given him the same combination, but today he has called back after 2 days. Sir, no purgation with Haritaki Churna and this one. I thought because he is an MBBS doctor himself, he has come to me for this treatment, and I don't want to give him a very strong purgative, and it may, so I started with a mild one, but it is not giving result. So it's not in every case the things will be same. So we need to alter the things. So if it is available with Avitpatikara Churna and you could be able to achieve the loose stools, that is fine, no issues. Our concept is Mrudu Tikta Virechana is the concept in case of handling these type of diseases. So if it is there, then nothing to worry.
In the Nitya Virechana, how many Vegas should we be expecting? How much is normal and how much is excess that we need to avoid?
We need to watch out for his pulse as well as BP, blood pressure. It should be around, be somewhere in the near to the normalcy. So his pulse should not be allowed to go down by 60, and his BP should not be allowed to go down by 100 by 70. It should be maintained above that. So in that reason, we will try to maintain them, and accordingly we will give the things. But all these things we will fix it when the body weight and everything we will understand. The doshic balance and even the protrusion of the belly, all these things kept in mind while deciding the dose. And 1 spoon or a half spoon or 1.5 spoon of Haritaki Churna, that depends on these type of things. And on one day, the day one, we will get the result of how many number of Vegas achieved. Maybe sometimes the patient say that with the same dosage and the day one he may get only 2 Vegas, but with the same dosage and the next day he gets 4 Vegas. So that is depending upon the number of days and accumulation. Early part will be cleared, and once bowel habits runs into normalcy, there are many factors that chip in. So we need to understand that where to stop it or where to reduce it should be constant monitoring is required, and accordingly we can manage it.